Should cannabis be regulated? Well, it's not as simple as you think. Recently, cannabinoids have demonstrated anti-cancer properties. To gain a full view, cancer and cannabinoids must be defined, as well as the three main types and where they are derived. Their potential use in the treatment of cancer using specific cannabinoids, the mechanism of action, which comprises of regulation of cell signaling, cell survival pathways, invasion into the cells, angiogenesis, and metastasis. To start off with, what is cancer? Cancer is an uncontrolled tumour growth caused by an abnormal amount of cell division. Tumours cause swelling in body parts, generally without inflammation, and can be either benign or malignant. Although the main type of treatment we use today for cancer is chemotherapy and radiotherapy. Cannabis is obtained from Cannabis sativa. There are three main types of cannabinoids: synthetic, endocannabinoids, which the body makes, and phytocannabinoids that come from the Cannabis sativa plant, including THC. Synthetic cannabinoids are psychoactive substances that mimic or produce similar effects to cannabis. These do not occur naturally. THC is the target of this research, so the synthetic drugs which are created aim to affect the same receptor as well as share similar structures. Endocannabinoids are bioactive lipids which are mediated by two G-protein coupled receptors known as CB1 and CB2, as well as other targets. These receptors are found in the brain, organs, and most importantly, on immune cells, and are responsible in initiation and maintenance of homeostasis. Phytocannabinoids are produced naturally within the Cannabis sativa plant. They are made by decarboxylation of their respective 2-carboxylic acid. Cannabinoids are soluble in non-polar organic solvents, alcohol, and fats, however are insoluble in water. Examples of phytocannabinoids are THC and cannabidiol.
There are three main cannabinoids which must be focused on, used in the treatment of cancer. These are cannabidiol, cannabinol, and THC, all of which affect slightly different receptors and therefore have different pathways to achieve their anti-cancer properties. There are four main receptors which start the cascade, being CB1, CB2, TRPV1, which is a transient receptor potential vanillate type 1 receptor, and GPR55, which is G-protein coupled receptor 55. Starting with cannabidiol, firstly, it activates the TRPV1 receptor. This leads to an increase in both hydrogen peroxide and calcium ions. The hydrogen peroxide then increases the amount of capsase, which is a proteolytic enzyme and causes the cell to undergo apoptosis. As well as this, the increased calcium ion levels leads to an increase in ROS, which is reactive oxygen species, via a damaged mitochondria, leading to excitotoxicity and then cell death. Other effects of an increase in ROS are the inhibition of the ID1 gene, leading to a lowered collagen IV matrix and reduces cell adhesion. Secondly, cannabidiol inhibits the CB1 receptor, which causes an increase in ROS. Cannabidiol also inhibits the CB2 receptor. This inhibition leads to both an increase in ROS and an increase in endoplasmic reticulum stress. This stress then forces the cell into autophagocytosis, followed by apoptosis. Lastly, cannabidiol inhibits the GPR55 receptor. This decreases the amount of ERK, which is extracellular regulated kinase. It also decreases AKT, which is protein kinase B, and decreases the number of calcium ions. This causes a decrease in protein synthesis, which decreases cell proliferation as well as cell migration. Cannabidiol has been shown to be effective in many aggressive cancer types, such as lung, breast, cervical, glioma, thyroid, lymphoma, skin, pancreatic, and uterine cancers. The second cannabinoid to be considered is THC. This acts to stimulate both the CB1 and CB2 receptors, leading to an increase in ceramide, ERK, as well as directly decreasing angiogenesis and metastasis. Ceramide is a lipid wax molecule and is responsible in cell signaling and consists of fatty acid and sphingosine, which is a kinase molecule. As the concentration of this molecule increases, disruption of the signaling pathways, therefore decrease in proliferation, followed by cell growth ending in apoptosis. A great increase in ERK causes the cell to also undergo autophagocytosis and then cell death. The last cannabinoid is cannabinol, and this follows the same mechanisms of THC. However, this cannabinoid mainly acts on the CB2 receptor. Its similarity is due to cannabinol being a metabolite of THC. Both THC and cannabinol have shown to be effective in a handful of cancer types, such as breast, large bowel, and small intestine cancers. As all of this has been demonstrated, is it possible to see how cannabinoids can be used as an alternative to current treatment methods? But the question still remains, should cannabis be regulated? Well, yes. At this current point in time, the studies are far from being completed, even though there is evidence of its application. It's not ready for use. However, if these cannabinoids pass through clinical trials, regulating them for the use of cancer treatment as a prescription drug may be a better option rather than cannabis as a whole, especially as there is a large issue of abuse concerning the hallucinogenic effect.